So here's Glenn Streeter with an incredible depth of information.
Thanks, David. Thanks, everybody, for being here. I'd really like to thank Dr. Lytle and Dr. Karasev for these technologies that are truly human-changing, and I'd like to thank Dr. Arena and David for introducing me to these things and the wonderful synergy that's happening right now. It's almost as if the collective wasn't ready, and now it is for these types of things. As David said, I've been an exercise physiologist for about 20 years. And it's a wonderful genre because it's very open. There's a very large scope of practice. But I became frustrated with ice and tape. You know, someone gets hurt, well, we have ice and we have tape. Great. What else is out there? Okay, well, we have ultrasound and e-stem. But really that world is dictated by the insurance companies. I wanted to step away from that world and be able to use things because they work, not because I was being reimbursed for them. So that's a critical aspect. And basically medicine is moving into this cottage industry where there are people in neighborhoods, like I spoke with Anthony earlier from Ireland. What a wonderful story. He bought a laser and he's helping people in his neighborhood without being a practitioner. So let's get down to what we're going to talk about today. There's basically two issues. We're going to speak about orthopedics, okay? And there's two names of the game here. One is getting rid of inflammation, and the other is regeneration. Everyone that you speak to or read about speaking about function, it all comes down to inflammation. So, and we know that both of these devices are highly effective at reducing inflammation, along with some other things which we'll get to. Another very important point here is thixotrophy. We're going to start with the easy words first, right? So what thixotrophy means is that every tissue in the human body is on this continuum from water to bone, softest, hardest, okay? Now, we're going to use the sprained ankle example because it's the most common and easy to look at. Let's look at a ligament, a healthy ligament in an ankle. As soon as that injury occurs, the body immediately begins to make that tissue more like bone. This is where we have scarring, inflammation, and long-term chronic reduction in range of motion, right? So the introduction of these things immediately, laser scanar, other things that we'll talk about, will allow us to bring that tissue back to a more aqueous state. Okay? Very important. This is my list of what we do for an acute injury. So in Ruth's case, it's a knee, right? So let's assume, even though this is a chronic thing, that she has just injured her knee. Okay? Here's the protocol. Number one is, believe it or not, Dr. Lytle's popsicle sticks in the mouth. Why is that? Well, take an extreme example of a beheaded cadaver, for example. Can that person feel any pain? No. Why? Well, even if they're alive, because the brain is what processes these things. So by realigning the jaw, we can actually get the parasympathetic nervous system to kick in and get a bit of pain reduction. Okay, the next obvious thing is ice, which doesn't just mean ice. It stands for compression and elevation as well. So an ice bandage. This is absolutely indispensable, a product called Wobenzyme. Why? Because Wobenzyme helps dramatically with inflammation, and because it's a proteolytic enzyme, it's very, very safe. It's not expensive either, and its only application is not just acute problems, but it's something that probably is wise to take all the time. Okay, this one's a bit controversial, but it's completely safe. DMSO, dimethyl sulfoxide. Now, DMSO by itself has some value, but its best value is as a driver. On top of that, I can put probably the best one now is emu oil or castor oil. Okay, and we can actually drive those fats into the acute. Then I like to laser. So let's assume that I've already iced Ruth's knee, and in the absence of emu and castor oil, which I'm out of right now, we'll use some Tramio, which is actually a good product as well. Yes. Okay, which knee is it, Ruth?
It's the right knee.
Okay, what type of pain are you experiencing?
It's dull and aching.
Okay, have you had it? Now, another function of the laser that we found in the research, and it's been my experience, that the laser is also a driver. So we're putting the Tramio or the emu oil or the castor oil on the joint, and then mode 1 is fantastic. Actually, mode 3. So I'm going to let Ruth hold that, and we're going to let the laser drive the product in. Okay, this is very important as an adjunct to everything else, to direct treatment. This is the World Acupuncture home website at acuxo.com. acuxo.com. Okay. Now, this website is amazing because you don't have to be an acupuncture practitioner to get a lot of value from it. Okay. This is outside of the left heel. And again, direct treatment is where we want to spend most of our time. However, trauma is rarely limited to the point that we're actually treating. Okay, so this is outside of the left heel. Now, if you don't have any probes, it's fine to use mode 1. I prefer the 660. You could use the 808, but I wouldn't do it for more than 5 or 10 seconds. Okay, now I'm going to check the next point.
Spleen 7, yeah?
Mm-hmm.
There you go.
Okay, inside the right calf. Could you hold that, Ruth? Thank you. Okay, right where the gastroc meets the Achilles tendon here. This is spleen 7. Yeah, Ruth just brought up a good point that it feels sore. Right. As someone myself who's a very novice acupuncturist, I've never taken formal acupuncture training. It's very intuitive where these points are. It's not difficult to find them. And even in lieu of the devices, just pressure can be valuable, but certainly the devices introduce much more energy.
And if we use the dove there, it would be sticky. It
Right.
would just be boom.
That's next.
Now, did you do like an assessment first?
Well, no, I'm assuming that's been done. I mean, this is a chronic
injury.
Yeah. It is a chronic pain for her, but I didn't really want to get into assessment since we're focused on the devices. Now, it becomes difficult sometimes to explain what's happening outside of a quantum physics background, but for the layperson, I like to view it in the toolbox that the laser is a paintbrush and the scalar is a hammer. That's a bit of a generalization, but certainly for orthopedics, the scalar is really, really powerful and very quick to shift things, particularly when they're harder tissue, right? It's on S1 right now. And it's chosen scalar mode. Okay. Now the great thing about the scalar, also for orthopedics, is it's a wonderful analog diagnostic device. It doesn't digitally tell you torn ligament, meniscus tear, broken bone. However, that stickiness represents the machine's inability to find ground, which it's attempting to do. So for Ruth here, I'm noticing a lot of tension on the quadricep, even laterally and even medially. So in an acute situation, we always want to brush a good ways away, up and down from the joint to find out truly where the bullseye is, so to speak, or what the Russians call the greatest asymmetry, right? Okay, now what I'm getting is the top of the quadricep is the tightest, or the stickiest. So what we're going to do is do the four points that Dr. Karasov teaches is to just kind of dissipate the energy here. Okay, and then I'm going to leave it still. Is that level okay? Do you feel it?
Yes.
Okay. Now keep in mind, the analog diagnostic capabilities are astounding. In other words, if this takes 3 minutes to dose, then we probably don't have a significant pathology like a complete tear. But if it takes hours and hours or even days to dose, now we need to look further and deeper into the situation. In other words, there may be an internal ligament tear or a meniscal tear that we haven't diagnosed yet if the device isn't dosing quickly.
You center it in the center of the area you find, and
right.
you dissipate.
Yeah, it's almost like closing. It's almost like finding the treasure, if you will. You're closing the gap and looking for these points. And as I said before, after being in this business for 20 years, the results that I've seen, especially for an acute injury, are absolutely astounding. Pain relief, increased range of mobility, decreasing swelling and coloring. If we can get the laser and the scanner on an injury as soon as possible, we can heal in half to a third of the time. And that's important because of scarring. As the body is allowed, without treatment, to continue down this path, we have scarring and we have calcification. How many people do we know that have had knee or back pain for 40, 50, 60 years and it's never been taken care of properly? Yeah, post-surgery, we've found that the devices help with infection. And if there is an infection, they can stave off infection, but if there is one, they can actually correct that. Pain relief, I think that the devices are far superior to ibuprofen. They're certainly not in the morphine league for power, but they are because they're actually healing rather than masking.
What about the healing post-surgery?
Oh, it's unparalleled. Could you hold that for a minute, Ruth? Great, let me take this away from you. You can relax that knee if you want. Here's your life path. Here's an acute injury. The body immediately goes into inflammation, right? And then if it's not taken care of properly, now we're looking at a chronic problem. And all chronic means is, on the fixotrophy line, remember, that something's becoming too much like bone and we need to get it more towards water. This is why ankles in particular, we have a sprain, it doesn't get treated properly, it gets sprained again. Why? Because that ligament has lost its elasticity because it's becoming too much like bone. Now I say that, it's not becoming bone. This continuum, there's an infinite number of places to plug in on that, but the ligament is too brittle. It's not soft enough. We found that the devices can actually create aqueousness and make that tissue more malleable and extensible.
Do you hydrate your patient before it started? If that would help the hydration of the patient?
Absolutely. In fact, there's a new breed of water alkalizing machines out there that are quite reasonable. The jury's still out on the long-term effects, but short-term, astounding what can happen by alkalizing. So we always give the patients alkalized water along with the WOB enzyme. Now Ruth is still having a long way from dosing here. So we're going to keep that there. Go ahead. Now here's another important point that's recommended by the manufacturers is to treat the opposing limb. Okay, so I'm gonna dove the knee here. Now remember, when you're brushing, you can turn it up more than you would if you were leaving it still, but don't shock the patient by leaving it still.
It really feels good.
Now if she were in my office, we'd be treating the bottom of her feet, the hands, the the ear, wherever possible, preferably.
This is dosing? You did it?
The macro system.
Nope, see the circle. Say that again?
You do the macro system, like the hand and feet.
Right.
But do you do that first, or you do that?
Depending, if someone was in real trauma and real distress, I would focus on the body part. But if they were in a relaxed state and post-acute, if you will, then go back, yeah. And then remember, we have the 6 points on the face, right? And then the spine, we want to treat the spinal erectors, the spinal cord, very important. C7 maybe, even to leave it there and wait for a dose, okay? Now here's where it gets great. People say, wow, I can't really afford one. And I say, this treatment is going to be powerful, but it may not be enough for this one day. So then we get into a rental program where we rent the devices for $150 a week, and many people are on board with that. In fact, we've paid for each device that we have in 3 to 6 months using the rental program. And then when people become impressed enough, they want to purchase one. Okay, while Ruth is doing that, let's talk a little bit about philosophy here and what's happening in the industry. If you go to YouTube, you can type in UC Davis has a biophotonics program. This is really exciting, the fact that you can go online and watch this doctorate level program for free. And the name of the program is The Effects of Light on Human Tissue. So for anyone who says to you, oh, that stuff is poppycock, well, why does a prestigious university like that have a program? Great information. Beeping.
How are you feeling there, Ruth? Feel different? Yeah. And what are you feeling?
Well, this was so soothing. This knee wasn't hurting, but it felt very soothing, and my whole system just felt much more relaxed.
And what he's doing, do you feel it's pretty simple to do that yourself?
Yes.
Or on someone else?
Yes.
Great.
It's just a matter of having the protocol down.
Okay, you've dosed. That's great. Now, in the realm of systemic issues, the laser and the scanar certainly stand on their own in terms of being able to shift. In orthopedics, there's a caveat, and that is that the devices are tools to allow for the holy grail of orthopedics, and that is willful contraction. Okay? It's not enough to be out of pain, and it's not even enough to have full range of motion. We as humans, and I think that everyone is an athlete at some level, right? We're here to enjoy movement. Movement should be joyful. When it's painful, it's not joyful. The devices are able to get us back to a pain-free situation, and then we can look at willful contraction, which means, for Ruth, go ahead and stand up for me. Okay, let's. I'm going to let you use the chair for some support here,
right.
but let's actually face like this. You're going to stand where I am. Okay. And we're just going to do some gentle squats, as low down as you feel comfortable. Okay. Go ahead and let me know if there's been some relief.
It just feels funny with
one shoe off and one shoe on. Yes. Good. Okay. Not that low. And let's try to keep the heels down. So as low as you can with the heels on the floor. Good. So now Ruth is reaching the holy grail, which is she's willfully contracting those muscles that have caused problems. You can take this to a whole level of resistance training, regular yoga classes, swimming, what have you. But that's really where we're at, and what the goal is. The other thing that we can do that works really well is scanar-assisted stretching. Okay? Let's say, let's do this, Ruth. Why don't you face that way? Okay? And we're going to pretend that you have a hamstring tension issue, okay? Why don't you reach over and touch your toes? Okay? So what I would do is take the device and brush while she's attempting to stretch that muscle. And as we find the bullseye and we really sneak up on where the most tension is,
That's amazing.
she's able to relax that muscle. Okay.
What's amazing, Ruth?
In my whole life, I haven't gotten down this way. Very tight hamstrings.
Okay, go ahead. You can have a seat, Ruth.
Something happened. What just occurred? Your demeanor shifted. What's going on?
Well, that was, just having my body be more pliable because it usually isn't at all. Never has been. It's really amazing.
Less than 2 months ago, actually less than 6, Ruth and I had this lovely conversation while she was flat on her back in her bed.
Mm-hmm.
So for her to be here and now to have this occur is literally a miracle. We could easily say that. So.
Go ahead and sit for me, Ruth. Now that's scanar-assisted stretching. I'm going to show you scanar-assisted contraction, okay? I want you to gently extend your foot and come up and touch my hand. And I want you to really stay there at the top, and I really want you to feel the energy from the device and use it to tighten that muscle for about 3 seconds and then relax. Okay, now drop down. If one's cramping in this situation, then we know that we have an electrolyte or a hydration problem, okay? And that needs to be addressed systemically. Okay, once again, let's come up and really focus wherever the device is. Let's go ahead and tighten for about 3 seconds and then release. Okay, this is unparalleled, and here's why, is that the bones in the body are spacers. The bones do not dictate shape most of the time. Okay, there is a caveat. Let's say there's a broken femur that heals at an angle. That's, of course, going to dictate shape. But a healthy scenario is that the bones are spacers, much like a tent pole that holds up the fabric and makes the tension in the fabric equal, okay? It's the muscles and the fascia that dictate shape in the human body. So by doing this, Ruth is actually getting her knee to be centered if we were going to do this in a clinical situation, it would be the quadriceps and the hamstrings basically realigning themselves and realigning the knee.
And it's going to help above that and below, too.
Absolutely. Very important point also is that the muscles in the body do not pull in a straight line like a cable. There's a twisting, just like the DNA, okay? Like taking a towel and twisting it. So with that in mind, as we picture how we're fixing ourselves, we can use the device in that fashion as well, rather than in a line. Is that level okay? And for people who you're trying to explain this to, it's simply a donation of energy. It's a jump starting of the car, the dead car battery. Okay? Because muscles are highly, highly charged because they're so aqueous, right? Like a car battery, they're filled with this mineral water that actually has contractile abilities. All that doesn't just come from the brain. The brain is where the will comes from, but the actual contraction is coming from that mineral water complex. You know what I love the scanar and laser for as well is I do a lot of outdoor activity. You put the scanar in your camelback. You never know when something's going to happen. We've had situations where someone hurt a knee. John has a good story. Would you like to share that, Rogo?
I actually hurt my knee up at Eldora. Glenn keeps these devices on him. I really twisted my knee while snowboarding up at Eldora. And When grabbed the device, I sat for about 20 minutes at the top of the mountain.
Leave it. Is that level okay?
While drawing
Feel
the
it?
crowd. Within that time, all the pain left, and I was actually able to enjoy the rest of the day. It was a miracle, actually. So it was remarkable, and I'm really glad that this technology is out there. And with the lens, so it's brilliant. Yeah, it's amazing. So there it is. Yeah.
Now, if we go back to the reason for being for Scanar in particular, could you hold that? Let's write down another key point here. I believe that the buzzword for the 21st century medicine is that with electromagnetics, we can create chemical changes. This is the reason for their use on the spaceships and what have you. Now, if it's good enough for the astronauts and special forces military people, why is it not good enough for you? We all know the answer to that. But the point is, it's a higher level of medicine because we're creating these chemical changes without the ingestion of a chemical. Okay? Very exciting. Because the body takes that raw material, those electrons, and knows exactly what to do with them in terms of ATP production, neuropeptide production, endorphins. How are you doing over there? Are you close to dosing? Now, we've talked about specific orthopedic problems, but let's talk about systemic things for a minute. There is an attachment for the Scanar, a rectal attachment, that has had tremendous success with people with paralysis or any type of large trauma like a car accident where there's really no specific orthopedic trauma, but there's systemic trauma. And a lot of that gets stored in the first chakra. And with the device in that area, tremendous relaxation can occur. We have people who have completely transformed their being after a large trauma like that with that combination. So definitely worth looking into. Well, for a particular car trauma case, we used... I did not... Because of my practice, I didn't choose to do the rectal probe with that person. I let them do it, but on their own, but they treated...
It's a wise thing.
Yeah. So they treated with the rectal probe and put the laser on the prostate, and then laser on sacrum, L5, belly button, GI tract. But obviously, just like Dr. Lytle talks about with the parasympathetic response in the mouth, that same thing happens at the other end of the alimentary canal. Okay. It's a little bit difficult topic for many American men, but the fact is, if you're traumatized, this is an amazing way to release that. And there's been studies that Dr. Rayner could talk more. I haven't studied them yet, but I guess there's great success with prostate cancer and things of that nature. So,
and for women, not just the rectum, but the vaginal probe is literally a miracle worker when you're working with things like endometriosis. You know, you're working with, the list can go on and on and on and on with that. When you're able to work with the mucous membrane and with the cosmotic signal, it becomes literally magic. Mm-hmm. So when it's deep in the body like that. So any kind of gynecological issue, just literally not many sessions before you see huge changes.
Sure.
So
let's do C7 here. And the other great thing about the rental and or purchase program is the device ends up being your buddy. I mean, you have your cell phone, and then you have your Scanar, you have your laser. I mean, if you're going to have a communication device, which is ubiquitous, everyone has a cell phone now, why not have a portable healing device? And I've traveled, like John had the story about us skiing, but traveling, sore throat, headache, little GI distress. I don't need to run off to the pharmacy, and I don't need to run off to the doctor's office or the ER. I can take care of this now on my own. And that's empowering. That feels good. And it's almost like borrowing. Like it's like a friend, to be able to borrow energy from.
The Russians call it the doctor in a box.
Mm-hmm.
Look at how fast that changed once you put the laser on my face.
Isn't that interesting? David, thank you for that.
When they're not dosing, think about it. Dosing means what? The structure.
Homeostasis.
The electrons aren't able to enter into the membrane.
Mm-hmm.
That membrane potential as well as the interstitial fluid isn't high enough. So now you're adding photons to get that up, and so it doses much faster.
Right.
So now the solution is truly, and you're going to be unique. So.
Just to point out, because the camera couldn't see it, the dosometer here was about 40%. When I put the laser on, it's now up to 90%, and that happened in a minute.
Right. So the other thing to help that, we find anywhere in the feet.
Mm-hmm.
There's a place in the feet directly related to that. So we'll just kind of go and how do you know? You just watch the response increase by putting it on a certain part of the foot. When it's up, you're in the right spot.
Exactly.
On the bottom of the foot?
You can do it anywhere, but for some reason we've really noticed it big time on accessing the bottom of the feet.
I should mention a couple other things. Pre-exercise, scalar and laser are unbelievable for preparing the body, increasing blood flow, particularly in areas that you're going to be sore. And then post-exercise, a nice Epsom salt bath followed by laser and scalar is really impressive for reduction of next day soreness and weakness. Life is this wave. It's not a particle, right? We're all quantum physicists in here to a degree. So we go through this period of putting out energy, maybe at work or through exercise, and then we have a down period. The devices can really lower that trough, or raise that trough, I should say, in terms of that recovery period. Instead of taking 24, 48 hours, it's now cut back significantly, and we can enjoy things to a much larger degree.
So it's really slowed down. Is that just dosed?
No, it's not. It hasn't dosed yet.
No, because this is off, isn't it?
Oh, that's what I heard.
Let me try the foot. Now, I didn't do the popsicle sticks, but keep that in mind. It really helps this whole process as well. To have them bite down, 3 back teeth, right?
Will they panic side?
Find the low side, like Dr. Lana did. Find the side is sore and you stick a popsicle in that.
I actually just do both.
Do both?
Yeah. Unless it's a head trauma, then I'll spend more time on the dental distress syndrome. For me, if we're treating a knee, for example, we just put 2 in and work from there. Because we know that there's a large percentage gain just by doing that without getting into...
Some people will ask, well, I'll just keep my mouth open when I get treated.
It's not the same.
That's not the same. When you literally put the popsicle sticks in, then bite down, and then the front teeth are not missing, that's a whole other program. And that's the one we want in comparison to that.
Isn't that great?
You use a pencil, is that too much?
The thing is that it's better to see if you're using a pencil, right? You're starting to get the eye teeth. Okay, it's interesting to signal to the eye teeth. So what we want is the back 3 teeth. That's why we cut a popsicle stick in a thirds or a quarter and stick that in. Okay, otherwise you can get other signal in here.
Do you have any success stories or suggestions with spinal cord injuries? We have a friend with a T11 vertebrae that was crushed.
Okay, that's an excellent question. I've actually worked with some folks who were paralyzed. We did see... First of all, the number one priority with those people is to stop the atrophy and stop the degeneration. Okay. There's another product called whole body vibration therapy, which is a plate that you stand on. That's indispensable for a spinal cord injury to keep the person from atrophying.
Is it also another protocol?
Well, DMSO works in the acute stage within a 24-hour period right after the injury. They actually inject it into the spinal column. But if that doesn't happen, now we're looking at longer-term problems. There have been studies. In fact, David just sent me something recently. There's a gentleman who is having success with spinal cord regeneration using the laser, not just directly on the cord, but on acupuncture points related to that. Well, that person can Google it. But certainly the regenerative qualities of these devices are without question, and I think it's just a matter of time. We could be looking at years. But what are your other choices? To wait for a stem cell therapy, which has some promise, but it's not here yet. Even if you did a stem cell therapy, the devices are still going to speed up that whole process as well. And the scanar is a stem cell. What's the exact way that you would say it?
It helps the body target them again. Mm-hmm. And then the problem, we're always making stem cells.
Right.
But we lose the programming of where to go for them to go for the body to then regenerate. Mm-hmm. So you're working with, again, that communication, so then now those stem cells are now targeted. Mm-hmm. But then there's another aspect, and it's not stem cells, it's called unicells. On the actual bone, the top of the bone, they're finding another cell, which is very similar to a stem cell, and that is another, like a stem cell, and it has the ability to then help the body regenerate.
In the periosteum.
There is also another mechanism that you have to remember, and that's differentiated cells of our body can become stem cells. And it's process of de-differentiation, and it's very new. Like they found that actually blood cells can de-differentiate and become stem cells, and then turn into the tissue that is necessary. So the body has this mechanism, and what they're finding that scanner actually supports that. And if the body naturally loses stem cells, which it does with age, of course, then the body is still capable of generating stem cells if we trigger the program.
Regarding the person online with the question, the only thing that any practitioner with integrity can say is what they would do if they were in that situation. I would do miracle bite tabs with the spinal cord injury. I would daily do the rectal probe with the scanar, maybe with the cosmotic, right, for maybe hours at a time, until it dosed, of course. I would be doing laser directly on the spot. I would be doing, if I could afford a 735, that I would be treating with that. And there's even other ways to introduce the 735 without having to hold it. You could use pads and things of that nature.
But then you would use, again, the Solaris blanket would be another aspect to
sure.
get that reflection back.
Right. Thank you very much, Ruth.
Thank you.
Do you have any relief right now?
Yes.
Wonderful.
Pain-free.
How do you feel differently? I mean, what's...
Well, I always had this low-level pain in this knee, and it's just not there now.
Wow.
I'm cured.
Now, let's keep in mind, it's unlikely that her knee is 100% right now. However, when we get the pain down, now she can go do some willful contraction, right, with the scanar. Let's say, for example, she wants to go do some yoga, and she can't get into lotus. You can actually take the scanar and brush, and lo and behold, we get 1 or 2 millimeters, 3 millimeters, 4 millimeters. We increase that range of motion. It's astounding. Thank you, Ruth.
Thank you.
Let me get John up here real quick so we can do something a little bit different. He's got a wrist issue. He fell. Exactly. Let's go ahead and take that off. I've been talking about acute injuries. Now let's talk about chronic here. Okay, what are we talking about chronic? We're talking about scar tissue. We're talking about calcifications. We're talking about unhealed fractures. We're talking about unhealed ligament tears. That's when you break out the 808. Okay, now we're talking 50 joules, is that right?
Yeah, 54 in 3 minutes.
Okay, now point to your most pain.
In 3 minutes, it's going to give more energy than the Q1000 does in 50
Okay.
watts. So.
Now, very, very important, an acute injury does not require that much energy to shift it, right? We have this continuum here. But a chronic problem requires enormous amounts of energy. Oh, wow. We literally have to get it back to neutral before we can get it back to regeneration, right? So, if someone, as a practitioner, if someone's coming to you and expecting a calcification, or like this gentleman, what's your name, sir? Steve, who's potentially looking at a knee replacement, we're talking, to be honest, we're talking weeks to months to reverse that. However, it has been done. I've done it on myself. I had a necrotic bone in my wrist. My distal ulna was broken, and for 3 years it was necrotic. Daily treatments with the laser and scanner and x-ray confirmed that it's no longer dead and no longer broken. The daily introduction for chronic problems of the devices, along with the Wobenzym and treatment of acupuncture points with the probes, can reverse these chronic problems. But remember what we're trying to get to. We're trying to get to willful contraction. So if that means someone does a 2-inch squat without pain, and then next week it's 3 inches, now we're making progress, right?
That's fantastic.
And again, if we can't move joyfully, then the quality of our life is diminished. Orthopedics is kind of the stepchild of medicine, because it's the ghetto of the body, many have said. The body does focus its energy on the heart and brain and the digestive organs.
So Glenn, you're giving a lot of energy to that area. Mm-hmm. So what's going on? What's your take on it?
He has a strained ligament and possibly a bone bruise in the metacarpals.
So you're going right at what point? Right where it's hurt?
Yes.
Right where the owie is?
Right where the owie is, which could be ligamentous or bone bruise.
It's feeling really good. Yeah, don't go skateboarding when you're in your late 30s, early 40s. That's a dumb idea.
Do you have another point on the wrist?
Oh, yeah.
You'd say secondary.
Yeah, right there.
Okay.
For sure. Yeah. Then, of course, I got the ankle, the shoulder,
So
the road rash.
Organ recital now over here.
So to reiterate what I just said, you can get results with a Q1000 or even a Q10 on a chronic problem. However, it's going to take a lot longer, and there may not be enough horsepower to push it over the edge depending on the issue, okay? So just keep that in mind.
My pain is gone. That's amazing.
And what pain did you have before?
A sort of a shooting, a burning sensation that was there sort of all the time. Soreness it felt like someone had just recently hit me, even though it was over a week ago. And then just sharp pains when I moved my fingers, and that's all gone.
Wow.
Yeah,
It looks to me like your range of motion.
Yeah, that's pretty much what I'm looking at. Yeah, it's amazing. Wow.
So Glenn, one thing we do in our practice, just to bump it up a little bit, is if there's a laser around, then he's got a hand.
Sorry, you feeling that?
Oh yeah.
Is that too high?
Oh, actually no, it's good. You can even go.
Yeah, you have him treat another place.
And he's putting that baby on there.
Okay, hold the scanner. Go ahead and brush where the pain is. Just to reiterate the value of the acupuncture, we'll check. Can we go back to Acuxo when you get a chance?
Move your fingers in that. Yeah, now do it. You're going to see it. Oh, wow. Really?
Oh, yeah, there we go.
Yeah. There you go. You'll notice some changes.
Okay, thank you.
By that.
Yeah, it seems to be going right into the center of the muscles and the ligaments now, oddly enough. Everything seems to be it seems to be straightening, if that makes any sense.
Yep.
I don't know if that's remotely.
No.
Wow.
You're now doing better work than possibly the best physical therapist in the world that doesn't have the equipment.
Yeah, I've been very blessed in my life. I broke my neck and crushed my head in, and I've had plenty of that, and this is much better. Yeah. And I'm not wearing a helmet. It's very pleasant.
Okay, you want to put that still?
Oh, I'm definitely accident prone.
Okay, here's the acupuncture point. What was this again? Lung 9. For wrist.
It's increased things on this side of my body, oddly enough.
Yeah, and watch how there's different...
Okay, watch the dosimeter right there.
Oh, okay.
Watch how that increases or changes.
Oh, wow.
Yeah, watch R.
Okay.
It's like hitting a gas pedal. Well, it's like a gas pedal. It begins to speed up as you apply the laser.
And that's a response from the body.
Mm-hmm.
You know, you're putting it in one area and it's directly affecting. Now, this is a big difference between us and Dr. Lytle. Okay, Dr. Lytle doesn't use the scalar, which changes the magnetics of the body to hold more light. So if you're using the scalar, you can use so much more light than you could if you don't change the magnetics. Now, what's another way to change the magnetics? Push it, pull it, move it around, all right? Or have someone else massage or palpate. That will change the magnetics or change the experience of the body more. So, but the scanner does it brilliantly. So we will use the light much more, and it will now be more effective than the other. So we're seeing a level of healing much faster.
Now, what about the more powerful?
Well, all you're doing there, it literally, the amount of joules for each device is the same. It's just one now is pinpointed, but it's not a soliton way. So the Q1000 is candlelight dinner for glands and organs. All right, it's candlelight for the body. You're not going to overwhelm it. All right, where the enhancers has a stimulating effect. You have a more of a push. All right, but if you need energy in a tube really well, like an acupuncture meridian or a whole system, there's nothing like the enhancer to do that. That's what's so beautiful about this. It's a toolbox. Okay, now if you were to buy that red visible light on the market, it would be about $5,500. But it's not here. Here it's an additional $1,700. You have your candlelight dinner for the organs, and now it's just a little bit more to get something much more powerful.
Can I comment on
Yeah,
that?
please.
I use both the 808 and the 660. The 660 has more of a working relationship with all the acupressure points. The 808 has more of a working relationship with bones and ligaments. But if you have something that is, like right now I have someone who had mesh installed, and instead of installing the size 10 that she is, they installed size 1. That's what it feels like anyway. And so it's really painful, like somebody is just yanking up all her, and it's numbed everything from that point down. And so the 808 allows the body to respond quicker to pain.
Thank you.
And even though it's an internal situation.
That thing is going to shift this so quickly.
But she has noticed that she does not use the 808 to stimulate other points. She says, no, that just doesn't make me feel better, but if I just use the wand, it's fine. She said, but it's like, it's almost irritating to me. And even some people have said, oh, that's hot. And we know it's not hot because it's a cold laser. But they'll feel heat because their body's responding to the energy in that point. So that's, if anybody says it's hot, you take it off, that's too much.
And then use just the Q1000, or if it was the 808, I go to the 660.
60, yes, go down. Yeah, that's my experience.
And every practitioner, to give an example, Dr. Lytle mentioned about someone who will use the 808, but only for 1 second or maybe 2 seconds on a client. And this was this is an incredible chiropractor who works with Parkinson's. For me to duplicate that, I'm working 30, 40, 80 seconds to help that person. My energetics are very different than that practitioner. That guy's, maybe he's just way more out there, and then in that 808 to carry that energy in.
I forgot, John, here.
So
you don't have any back teeth.
That's why we give guidelines, and we can give you what we know, but it's going to be different for every person. And
I'm
that's why
missing
we
Keith
listen.
from an accident.
So,
Oh, we're doing the popsicle sticks, but I'm missing Keith on my back left arm from a surfing injury.
oh,
Yeah. That was a funny day, too.
do you work?
Well, yeah.
Stuntman?
John's going to become the
Nothing
world's
more.
greatest laser and scanner salesman. He's so excited about these technologies. He called me up the
Yeah,
other day.
well, they work.
Glenn, I want to go. I want to learn as much as I can. I'm ready. He says every time something happens to me, these things shift it, and
Yeah.
I'm on board.
Yeah, I did. I'm not kidding. I did break my neck, and Glenn worked on me, and he used a laser. I think one he's got in his bag, and it was profound to a point where I can't even describe it. It's like trying to describe, opiates.
He actually passed out.
Yeah.
We did laser and scanner and an adjustment, and he actually passed out.
Yeah. It was,
In a good way.
in a
Yes.
very good way. In a very good way.
All right, guys. We
Question?
got just a couple more questions because we really got to get ready. Go ahead.
Now, when you treat a joint from an injury, do some of these same protocols occur when the problem with the joint is really a central nervous problem, like the stroke, the CP, or different things that cause these spastic muscles to do this to these joints? Or do you just...
Well, I would certainly treat the individual joint. The problem is that's like putting your finger in the dike, right?
Yeah.
I would definitely focus on brain, spinal cord, sacrum, but there is a way to stem the tide. As I mentioned to this person online, the number one goal is to stave off the atrophy. So if that means treatments daily with manipulation, the introduction of a vibration plate.
You recommend that in a situation?
Absolutely. Even just in the wheelchair, putting the feet on the whole body vibration plate, unbelievable. And this technology was $15,000. We have them for $500 now for the home, and they're decent. They get the job done. It's interesting. It's the introduction of energy. It's just very crude energy. It's not refined like the laser or the scanner.
But that's a good addition to laser and scanner energy.
Well, it's indispensable in a situation where someone is immobilized. Even for organ function, getting the digestion moving again. Very powerful.
We have one more question.
Sure.
After treating something like a sprained wrist, would you immobilize the area or advise them to keep it moving?
That's an excellent question, and
When are you going to advise me to do?
if it's acute and very, very sore, and, well, first of all, if there's a fracture, it has to be immobilized. If there's a ligament tear, it has to be immobilized. After that, it comes down to whether the patient feels there are aggravating things or not. 1 or 2 days of immobilization isn't going to create atrophy, but it could be the jump start to protecting that joint. So that's probably, when in doubt, immobilize.
Great. Anyone else in the group? Okay, we're going to need to...
Thank you all for the opportunity, and